right, so one of the first muscles that I look at when I'm treating elbow pain, the very first will be the tricep muscles. You'll be surprised. Triceps refer, especially the trigger points in the tricep, whether it's the medial or the lateral head, will refer directly into the elbow itself. Okay, you'll find a lot of the trigger points in the extensors actually doesn't refer to the elbow, they refer to the hand. So it's important that we're clearing out these muscles through here in the triceps, which refer beautifully into the elbow itself. So first place will be triceps. The next muscle that I'm going to be looking at is going to be brachialis, which is a hidden muscle, which is sort of deep between the biceps brachii. If we push that out of the way and sink in there, and it's right up against the humerus. All right, so we have to be really mindful about nerves, and we also have to be really mindful about the pressure we use because we're pushing back up against bone. So it's a sinking in process. We'll have the elbow flexed, and we'll be looking for that trigger point. So we're going to improve that flexion extension. Sometimes I'll bring in a bit of brachioradialis because obviously it's a bit of a flexor as well, but it's not necessarily my absolute number one go-to. The next muscle for me will be, believe it or not, the extensor carpi ulnaris. Now, I know if you look in the literature, especially with overused tendons, a lot of focus gets put on the extensor carpi radialis brevis as the main source of elbow pain. I tend to disagree a little bit. Yes, it does get involved, but I'd absolutely say clinically, extensor carpi ulnaris is by far more of a positive muscle in terms of elbow pain. So we're definitely looking at that one for sure. And then we've got this amazing little muscle that also gets missed as well, and I love it here. And Dean's actually got you've actually got a really well-developed one. I don't know why, you must stand around in extension a lot of the time. And that's called our anconeus muscle, which sits in this little pocket here. And it is the last part of our elbow extension. So we use that to lock right out. And it sits in this little pocket there, so you can see it right there. It's a beautiful little trigger point there. Once again, it refers straight into the lateral epicondyle as well. And then if we spin over this way, we're going to come in and we're going to work the supinator muscle. Now, supinator muscle, a lot of people say, oh, why supinator, why elbow? Well, a couple of reasons. Supinator muscle obviously lies deep in here. Yes, it's difficult to get to, but you will be able to basically just slowly push the brachioradialis and sink in up against the radial bone. Now, what's important about supinator is the deep radial nerve passes, well, one of the branches passes through the supinator. And what can happen is sometimes if you get some hypertonicity in there, it can sort of entrap the nerve a little bit, and then you'll end up with what we call radial tunnel syndrome. Now, radial tunnel syndrome actually mimics lateral elbow pain beautifully. So they'll be feeling it out here. What you'll find with radial tunnel syndrome is that they won't have these positive signs on grip and wrist extension. So then straight away I've got to think, right, so what's happening with our pronation and our supination as well? So the radial nerve coming in there is really important because it will refer pain to the lateral elbow. And then the next muscle will be our pronator teres. Okay, so once again, it's another really important muscle. It gets missed so much, so important because of our supination, pronation. We also have the median nerve that comes underneath the pronator, which is actually, in my opinion, I tend to find if we're dealing with carpal tunnel problems, it's the main entrapment site before it gets down here. But from our point of view, and talking about lateral elbow pain or medial elbow pain, it's definitely one of my number ones. All right, so let's get into some treatment and I'll show you how I go about this process. So Dean, what we might get you to do, if you don't mind, can you flip over for us? Just face down. And I want you to just bring yourself just a little bit to the side. No, the other way. Yep, that's it, perfect. Just pop your arm down there. Beautiful. So what's really important here is when we are doing these techniques on the triceps that we definitely have support underneath the elbow and the arm itself. Okay, there's nothing worse than having the arm hanging off here and it's not supported and then you're putting pressure back onto the shoulder. So it's really important. So one of the things that I do is, that's why it's important sometimes to have a wider table as well. Now, just pop that there. So pop a towel underneath there, and that just opens it up a little bit more. We get a little bit more support. So first place that I'm going to start, believe it or not, is going to be the medial head here. Now, the medial head occupies 2 trigger points in the mid-belly area here, and they refer beautifully into the lateral epicondyle, believe it or not. That's the medial head. If we go a little bit further down and we get into, I suppose, the proximal trigger point, which is right near the elbow itself. So we've got to make sure that we don't come in this way where the ulnar nerve is. So you're not going to be pressing into the ulnar nerve, because if they start to get pain or paresthesia, get off it. That's the ulnar nerve. So we come down here, and then we've got a trigger point that actually refers into the medial epicondyle. So once again, mimics medial pain. We come down a little bit further on the lateral head down here. We've got another little trigger point in here, and that will refer also into the lateral elbow as well.